Hey there, it's Dr. Rory Cernik again from the Hearing Assessment Center. With me today, I have a very special guest, Barb Cernik. Thank you for joining.
Thanks for having me.
During our last segment and video, we talked about noise trauma and noise-induced hearing loss, and that's when we learned that every day there are 22 million Americans working in environments with potentially high-level noise, and many of those people are firefighters. But today, I want to specifically talk to retired firefighters. Whether or not you know it, it is likely you have some level of hearing loss, and for some, that's going to mean a reduction in your quality of life. And if you were employed in the 70s, 80s, and 90s, particularly if you were in an open cab, I can almost guarantee you have some type of workplace noise-induced hearing loss. And if you don't believe me, ask your family, ask your spouse. You don't have to live like this. That's my message for today. And it is likely that you can work through a workers' compensation case. And my role with our patients is to establish what is called a burden of proof. And there we will simply determine whether or not your hearing loss is related to workplace noise exposure. But today, there are 5 steps. I want to give you some actionable items right now that you can do. Barb, what's step 1? Where do we start?
The first step is to call our office and make an appointment. We have offices in Lutherville, Perry Hall, Bel Air, and we even have one in Warrenton, Virginia. Step 2, we will set you up for an IME.
And what that is, it's an independent medical examination, and there the forensic audiologist at the Hearing Assessment Center is going to do specialized tests to determine if there's hearing loss, but more so to determine whether or not it is related to workplace noise exposure. And so next time, stay tuned, we're going to talk about steps 3, 4, and 5 with our ultimate goal of providing you and you being awarded free hearing health care for the rest of your life. Stay tuned.